Hi, I'm Dr. Corey Waller, the Chief Medical Officer here at Brightview and one of the medical providers as well. And I've gotten a lot of questions about methadone, a medication that has over half a century, so over 50 years of use in the treatment of opioid use disorder, and really one of only 3 medications that we can legally utilize that have good data for the treatment of opioid use disorder. But this one in particular has a little bit of a stigma to it, just given that it started back in the day when it was in a clinic in the back alley on the side, of a road outside of town. And it somehow, despite being the most successful medication in the history of treatment of almost any disease, became something that people misunderstood or maybe even thought negatively about. And unfortunately, I think this has hurt us as a society in trying to treat what is the number one cause of death for people under 50 years old, overdose. And so if we had access to methadone at scale, we would have one more tool in our toolbox to help people recovering from opioid use disorder. It is safe and effective and it has the best long-term outcomes of any of the medications we use. And interestingly, it is the basis by which we test every other medication in addiction. And so what that means is that it is so good at what it does that we want to see if other things can even compare to it before we decide to allow it on the market. When we talk about methadone specifically, it can be a little scary because it's something that we have to ramp up over time. We can't just start you on the dose that we want to start you on. It may take a little longer than it may feel comfortable in your mind, but in practicality, we can get this to the right dose for you very quickly. And for most people, it has very low side effects and definitely has a chance to decrease your risk of relapsing onto other opioids over time. And most importantly, it is one of only 2 medications that has been shown to decrease your risk of death. And that is the first thing that we have to do. And so if you're considered a candidate for methadone, just know that it has the longest and densest amount of data in all of history for a medicine that we use on a regular basis. And this absolutely might be the pathway for you.